Have you ever felt overwhelmed by mental health challenges? You're not alone. Millions face these issues daily. Let's explore a solution that can help: Primary Care Behavioural Health. Primary Care Behavioural Health, or PCBH, embeds mental health services into primary care. It makes sense, right? Early identification leads to better treatment outcomes. So, how does PCBH work? First, we emphasize screening for mental health concerns. This step helps us identify issues like anxiety or depression. Next, we focus on brief interventions. These are simple strategies, easily applied in primary care settings. They prepare patients for further treatment if necessary. The third step is implementing stepped care. This means providing care tailored to the severity of the patient's issues. More severe cases receive specialized attention. Lastly, we establish referral pathways. These links between primary care teams and mental health specialists are vital. They ensure patients receive the care they need. Now, let's consider Zambia, facing a big mental health treatment gap. There are few services outside urban areas. Stigma often stops people from seeking help. Integrating behavioral health into primary care can change this. It lowers access barriers and normalizes seeking help for mental health issues. Practical solutions are also available. Training primary care providers in basic mental health skills is essential. Deploying lay counselors and psychological support workers in clinics also helps. They bridge the gap where specialists are scarce. Creating referral connections to district psychiatric services boosts care continuity. Successful task-sharing research supports this approach. Non-specialist health workers can deliver effective psychological interventions. With proper training and supervision, they can make a difference. In Zambia, pilot programs have trained community-based counselors. These counselors use problem-solving therapy and cognitive behavioral approaches. The results are promising. These initiatives improve mental health outcomes significantly. They also promote adherence to long-term medical treatments. Key factors for success include ongoing supervision and culturally relevant interventions. Monitoring and evaluation frameworks help ensure effectiveness. Additionally, addressing stigma through community engagement plays a huge role. Conversations around mental health need to happen, and support must be visible. In summary, primary care behavioral health can bridge the mental health gap. By embedding these services in primary care, we can help millions. If you or someone you know is struggling, reach out. Take the first step towards better mental health today. Let's change the conversation about mental health care.